Good morning, everyone. Today, we will be presenting our community health nursing assessment focused on unsheltered people in downtown Toronto. We aim to highlight their vulnerabilities, health challenges, and the strategies we propose to address their needs. Our team are Lian Pearl Alejo, Giselle Gabino, Niro Donga S., and myself, Cheryl Lakap. Rationale for choosing the community. The community of unsheltered people in downtown Toronto has been chosen for this assessment due to their significant vulnerability and the urgent need for targeted health interventions. This group faces numerous health challenges, including exposure to the elements, limited access to healthcare services, and higher rates of mental health and substance use issues. Focusing on the community allows for the development of tailored strategies to improve their overall health and well being.
Community identification and definition. The community we focus on includes individuals experiencing homelessness, living on the streets, in shelters, and other temporary accommodation in downtown Toronto, specifically in areas like the Financial District and Entertainment District. Statistic provided by the City of Toronto Streets Needs Assessment in 2021 indicates that nearly 8,715 individuals are experiencing homelessness, with a significant number residing in downtown. Epidemiological study further highlights that those experiencing homelessness have the higher prevalence of chronic illnesses, mental health disorders, and substance use disorder compared to the general population. And to assess the health needs of this community effectively, we employed a mixed method approach. The first one is needs assessment. We identified health needs through surveys, focus groups, and interviews with the community members and service providers. The second one is windshield survey. This observational method provides insights into living condition and environmental factors affecting this population. The third one is informant interviews. Engaging with the healthcare providers and community leaders reveals challenges and strength with the community. The tools that we use include surveys, observational data collection tools, access to municipal databases, and collaboration with the local organizations. And for our rationale for assessment methods, these methods provides a comprehensive understanding of the community needs. Combining qualitative and quantitative data ensures we capture a holistic views of the challenges faced by individuals living without shelter. The information sources were reliable, drawing from the municipal databases, local organizations, and academic literature, including significant contributions from the City of Toronto and notable researchers in public health.
In our analysis of the unsheltered community in downtown Toronto, we have identified several critical aspects of their current situation, strengths, and challenges. Firstly, the current situation highlights some pressing issues. There are high rates of chronic diseases, mental health problems, and substance use among the community members. Access to consistent healthcare and social services is limited, making it difficult for these individuals to receive the necessary care and support. Additionally, they are frequently exposed to harsh environmental conditions, which further exacerbates their health and well being. Despite these challenges, the community possesses notable strengths. The resilience of community members is remarkable, and there is a strong presence of dedicated service providers and existing outreach programs that offer crucial support. However, significant challenges remain. The lack of stable housing is a primary concern, contributing to the ongoing cycle of homelessness. Stigma associated with homelessness and mental health issues further complicates efforts to provide assistance. Inadequate access to healthcare and fragmented service delivery systems pose additional barriers to improving the quality of care for these individuals. Addressing these issues requires a comprehensive approach that leverages the strengths of the community while tackling the systemic challenges they face. In our efforts to support the unsheltered community in downtown Toronto, several key capacity building strategies have been identified. First, we aim to empower community members through health education and advocacy training. By providing the necessary knowledge and skills, individuals can take charge of their health and advocate for their needs more effectively. Additionally, we are focusing on strengthening partnerships between healthcare providers and social services. Collaborations between these sectors are crucial to creating a seamless network of support for the community. Several organizations and services play a vital role in this initiative. Shelters such as Fred Victor and the Salvation Army offer essential support and refuge. In the healthcare sector, the Toronto Public Health and Inner City Health Associates provide critical medical services and outreach. Gatekeepers and stakeholders are integral to our strategy. Gatekeepers include shelter managers, outreach workers, and community leaders who have direct contact with the community. Stakeholders encompass unsheltered individuals, healthcare providers, social workers, and policymakers, all of whom have a vested interest in the success of our initiatives. Effective communication is crucial for the success of our strategies. We will hold regular meetings with service providers and community leaders to ensure ongoing collaboration and coordination. Utilizing community forums and focus groups will allow us to gather valuable input and feedback directly from the community, ensuring that their voices are heard and their needs addressed. By implementing these capacity building strategies and fostering strong communication, we can create a supportive environment that addresses the immediate needs and long-term goals of the unsheltered community in downtown Toronto. In our efforts to support the unsheltered community in downtown Toronto, it is crucial to recognize the voices that are often unheard. This includes women and LGBTQ plus individuals experiencing homelessness, as well as people with disabilities who are unsheltered. To ensure these marginalized voices are included, we are implementing targeted engagement strategies. This involves conducting focus group discussions and interviews specifically designed to reach these populations. By collaborating with specialized advocacy groups, we can ensure comprehensive representation and address the unique needs of these individuals. When evaluating our approaches, we acknowledge both strengths and limitations. On the positive side, our strategies allow for comprehensive data collection and the inclusion of diverse perspectives, providing actionable insights. However, potential biases in self reported data, challenges in assessing or accessing certain subpopulations, and constraints related to time and resources are notable limitations. Advocacy and ethical considerations are at the forefront of our efforts. Ensuring confidentiality and informed consent during data collection is paramount. We are committed to advocating for policies that address the root causes of homelessness and promoting equitable access to healthcare and social services for all community members. By actively listening to the voices not typically heard and addressing ethical considerations, we can develop more effective and inclusive strategies to support the unsheltered community in downtown Toronto.
Throughout this assessment, we gained valuable insights. First, the high prevalence of health issues due to environmental exposure and limited access to care. Second, the complex needs of individuals necessitate a multidisciplinary approach. Third, the importance of building trust with community members and the critical role of advocacy in addressing systemic issues. Fourth, we also came to appreciate the resilience and resourcefulness of individuals experiencing homelessness. Our assessment underscored several key insights into community nursing. First is mixed method assessments are valuable for capturing community needs. Second, stakeholder engagement is essential for effective interventions. Third, ongoing evaluation and adaptation of strategies are necessary to remain relevant. Fourth, culturally competent approaches are significant in ensuring inclusivity. Fifth, we must recognize the impact of social determinants of health on community well-being. Reflecting on our group process, we realized effective teamwork enhances the quality of community assessments. Collaboration leads to innovative solutions. Communication and coordination are core to successful project outcomes. Sharing diverse perspectives enriches our assessment process, and continuous learning and reflection are vital for improving our community nursing practice. Our assessment of unsheltered individuals in downtown Toronto presents a unique opportunity for targeted health interventions. By focusing on the strengths and challenges of this community, we can develop strategies that not only address their immediate healthcare needs but also advocate for systemic challenges that promote long term well being.